Now, coming back here to studio, we're focusing on the role of nutritionists and dietitians in the healthcare system. I do have the leadership of the Kenya Nutrition and Dietetics Students Association. We do have the founder and the president, who is George Omolo, also the treasurer, Stephen Arnold. Let me start with you, George. Welcome to our set. Is this your first time, first of all?
This is my first time in KBC Studios.
Okay, so welcome. So let me start with that particular question. Why is this important? Why should we focus on our nutrition and diets right now?
It's actually very, very important because currently, you see, much of our focus is put on curative, medication and those kind of things, but we are moving to preventive way of managing of diseases and conditions. So we don't want people to get to a point where they have to be cured, but we want you to prevent the situation before it gets worse. And that is what the role that nutritionists do play, preventive, and it's very important. Because currently, if you look at even malnutrition cases, about 18% of Kenyan children below the age of 5 are suffering from stunting. Even if you even look at obesity cases, about 10% of modern women are suffering from obesity. But see, all these conditions are conditions which are well managed by a nutritionist. But if they're not recognized, if their input is not, put into, is not given the importance it deserves, then we have a nation that will still continue suffering. So we need them to be integrated in the healthcare system. Yeah.
And Stephen, similar question that I just asked to George, especially in our African countries, especially here in Kenya, we do eat things that are grown from the soil, because agriculture is our backbone here in the country, as opposed to what we see in the first world countries. So aside from the obesity cases George is talking about, what have you noticed that is affecting us as Kenyans?
Okay, thank you for having me. On to that question. In Kenya, there's a high rate of obesity, NCDs especially. We're talking of diabetes. I've worked in a healthcare system, and I noticed that when you're talking of NCDs, especially HIV and diabetes, there's a really high rate in terms of the two. So looking in the integration of nutrition and nutritionists and dietitians, it will really play a big role, especially in the management of these two conditions, which are really paramount in the country. Yeah.
Are there other issues that you have witnessed, especially within how we consume these foodstuffs that we do have? Is it some are genetically modified, or is it the natural one that is affecting people, especially when it comes to what the farmers are using, like the pesticides and other chemicals?
Yeah, actually, yes. Most of it is because there's what we call nutrition transition, where you find people now are transitioning away from the traditional way of consuming food. They're moving to the westernized kinds of food, the highly processed food and those kind of foods. And it's very prominent even in the urban centers. But besides that, even the foods that are being, that farmers, are planting, we have things like using of the pesticides. Some of them also will affect the crops. And when we take them, we end up suffering from various conditions. So we're looking at the pesticides. Even the nature of the soil. Some of the soils that we use is already contaminated. Yeah, so the nature of the soil, the pesticide that we are using, the using of high processed foods as well. So those are some of the issues that are causing problem and leading to the high rise of NCDs in the country. And my take is that we have that rise in that because the role of nutritionists have not been recognized in the country. If you look at even among the population, the nutritionists are perceived as food policemen or women to police you on the kind of food you're supposed to be eating, which should not be the case. Nutritionists should be there to more like a preventive care managers to prevent you from getting all these conditional indications. And we are saying this because even among the government, even if you look at the policies, we have a lot of policy gaps that undervalues the role of nutritionists, and that's why even the population does not value the role they play. And that's why we are seeing rise of all these conditions, NCDs, and even stunting among children under 5. Yeah.
And especially for your institution here, how have you tried to ensure that those gaps that are witnessed, how do you plug those gaps and address some of those concerns that Kenyans are raising, that some of them even do not know nutritionists are in this country?
Okay. In third year, there's a unit called Nutrition Education, where it is taught among all institutions, where students are being taught on how to educate the public on raising awareness in terms of these nutrition issues. So For example, for my case, we were taken to Githurai in Kiambu, and we were able to talk to the people, the public, about raising awareness on how nutrition plays a role, especially in terms of food safety and healthcare systems in their health as an individual. Yeah.
And in terms of some of these cases that you have witnessed, especially for obesity, where have they been recorded? Is it in the urban sectors or is it in the rural areas?
Okay, traditionally it was more in the urban centers, but now it will be surprised to note that even much more cases are coming up even in the rural setup. With the devolutions, and we're having counties and everything, so you find people have migrated to the rural areas. So the practices in the urban have shifted to the rural areas. So even the kind of nutrition, even if we talk about the high processed foods, we have too much of those in the rural areas, even as we speak, in the counties, centers. So the cases are now, it's more all over all the places. So what we're simply saying that this nutrition is then, and that's where I was talking about policy gaps. For example, if you look at the Health Act 2017, or even the universal health coverage rollout, where the impact of the roles of nutritionists were not actually well recognized. And even if you look at the county governments, in terms of the absorption of nutritionists is quite low. Even in the budgeting, county budgeting of nutritionists is quite low. So you find, because of all those issues, and like I talk about nutrition transition, even in the rural areas, so the NCDs are coming up, even in those areas, but the people who should help us, to manage this are still not available in those areas. And I'll surprise you if I tell you, if you look at the WHO recommendations, WHO recommends that for every one nutrition professional is supposed to serve 10,000 population. But do you know the ratio in our country is one nutritionist to 500,000 patients or population?
What is the risk of that?
That means the population are not getting the service they deserve from nutritionists. They're not getting. The population does not know nutritionists exist. They do not know what the role of a nutritionist. In fact, now if somebody has an NCD or diabetes or hypertension, the first thing they think of is to get medications. But in their mind, they will not think of maybe the lifestyle changes, the foods, or even the role of, or even think of a nutritionist as a professional to help them in that journey. And that is because of that underrepresentation or underutilization of nutritionists in the country. And our association, what we are trying to do, because our association represents the students in the country who are undertaking nutrition and dietetics from all levels, diploma, degrees, and early graduates. So we are trying to tell them, now this is the time where you need to put your voice out there. You need to let the population know that you exist and what you do. Because initially we never had those voices. Everyone was doing their own thing outside there. So we're trying to bring all of them together in one platform and then tell them to go and speak out, whether in your homes or in your schools, whatever gathering you have, make your role and space be heard so that people can know you exist and they know what you do. So those cases can be brought down because 18% of stunting under 5, it's quite a huge number. 10% of women suffering from obesity in the urban slums is quite a big number. And what we are talking about is not unique because if you look at countries like Rwanda, what they did, they integrated nutritionists in the community health program. And that was what we are talking about between 2015 2020. And within that period, stunting cases reduced from 44% to 33%. And you can see because of the integration of nutritionists in the community health program, which doesn't exist in our country. So what we are saying is not something which is not achievable, is something which has been done with other countries. We have also Australia, Canada doing them, and they're succeeding. So we want the same to be adopted in our own country so that these nutritionists can be adopted to that program. And do you know how many nutritionists graduate every year? It's quite a huge number. But how many are absorbed in the national, in the national health system, even county? Quite low. If you look at the ratio I was talking about, in Kenya is 1 to 500,000, and like WHO recommendation of 1 to 10,000. So you can actually see where the disparity is. And that can only be addressed through the policies. And that's why we are coming in as students and also as not even students, but even young professionals. And professionals shall come after us. We need to speak so that the policy makers or those who are concerned should really know and appreciate our role and see how we can, manage the elephant in the room, which is the NCDs and stunting among children. Yeah.
And my question to you, Steve, because you see, at the end of the day, it's people have graduated, there are no opportunities in this particular sector. Why not go outside the country and serve other nations?
Well, as because the saying goes, charity begins at home. And going to seeking out for better opportunities at other areas leaves out your country behind. So first of all, before I go there, I think the Health Act of 2017 lacks a direct reference, especially when it comes to the role of nutritionists and dietitians in the country, because it speaks about the holistic approach. And as George has said about the ratio of nutritionists, you find most nutritionists, when they're in the health sector, they don't know what they're there to do, their job exactly. So I think with that, it leaves out the nutritionists and dietitians out of the healthcare gap. So when you talk about living to better opportunities, which is actually a better option, you find it becomes hard, especially getting into these countries, and especially being UK. Most people used to go to UK and Australia, but having to leave out your country to go and help on the other sectors, still at the end of the day, you leave a gap in the healthcare system in nutrition and dietetics roles in the country, in Kenya. Yeah.
And George, where are the hospitals in this respect of addressing the gap, that particular gap you've just mentioned that has been cited by the World Health Organization at the end of the day? And also, is it easier for you to start your own clinic as a nutritionist?
Well, okay, if asking about where are the hospitals are, they are there. We have national hospitals, the county, the level 6 up to the level 2. But if you look at the number of the nutritionists that employ is very low, and that's why you look at the ratios coming in. You'll find a whole hospital, even level 6 hospital, having only 2 nutritionists to serve all that population, to serve a whole county, for instance. And that is not enough. That's why the ratio is coming from 1 to 500,000. As you can see, that's a big problem. And then you're asking if nutritionists can start their own clinic. Yes, they can. But is everyone has an access to capital to do that? Not everyone. Not majority will have the capital to start a nutrition clinic, because again, it's capital intensive. And besides being capital intensive, and also we are talking about the population not being aware of the role of a nutritionist. You may start a clinic, but then who will you serve? If the population does not know your role, does not know you exist, they only think of you as a food policy or a food police person or a woman, they won't even come and see you. So that's why we are saying we need, of course, the institutions of higher learning, we need the government, the Ministry of Health. We also need, of course, the media and associations like ourselves to be able to talk to the public, let them know that we do exist, what do we do, how we can help the patient, and what is our role actually in the healthcare space. So that when person has, the NCDs, for instance, we are talking about hypertension, diabetes, even cancer, then they know they can see a nutritionist to help them manage, to have dietary interventions before they scale it up to medications, for instance. Or before you get to a point where you are suffering from an NCD, try preventive, work with the nutritionist, seek a nutritionist to take you through the journey, then scale it up to, medication and such. But that cannot happen if there is no public campaign on awareness and what is of letting the public know what is the actual role of a nutritionist in the healthcare space. Yeah.
And Stephen, given that you've talked about some of the challenges, especially the Health Act, you've talked about lack of awareness. So what have you done as an institution to reach out even to the Ministry of Health, given that you see that's the umbrella body for all the health sectors here in the country? Or do you have any other umbrella body that you report to as an institution?
Okay. Well, we have a union that covers for nutrition and dietitians. It's called KUNAD. However, I think maybe they still need to up the game, but we are coming there. Yeah. So through the union, there's the people who are supposed to cover for the nutrients and the dietitians challenges that we're having. However, with cancer, as taking it all right now, as the fact that you're still students and you're covering a large scope in the healthcare of nutrition, it means in a few months or years we are going to change it. Yeah.
And George, also to the other issues you were talking about, especially in terms of reaching people down there. So as a association, what have you done to ensure that people know about what nutritionists do, aside from being policemen and women of food?
Yeah, we've done quite a number. The first thing we've done is community education programs. We've had several, for example, in Kawangware we had one. So we've had one in some of these, we call them the slum areas in the country. So we organize students from different campuses. We come together and then we go and do, well, there's a medical camp, then we do nutrition education among that population to teach them, for example, if they are expectant mothers, we teach them about breastfeeding and why it is important. We also take them through the right kind of foods they can choose when they're suffering, or when they're in different stages of their lives. So that one we do. Apart from that, we also do webinars. Webinars is more of a virtual training, but this is done mostly to those who are able to access internet. So we do that to them, at least in a week we can do 4 times. Yeah, but in terms of those who are out of reach of internet, we do community engagements and and programs. Yes.
Maybe, Stephen, to Kenyans who are watching you right now, what benefits, if they visit a nutritionist today, what benefits are they likely to get?
Okay. First of all, nutrition covers a bigger scope on healthcare and agriculture. So when you visit a nutritionist, the person is going to advise you more on in terms of health management of your condition with food, and as well as agriculture, how to manage agriculture. Right now we are pushing for those people in urban areas. We are pushing for kitchen gardening. So with the integration of agriculture and healthcare, we are going to help you in the management and prevent, because nutrition covers preventive, curative, rehabilitative. So if you visit a nutritionist right now with a condition, we are going to help you with the curative, and before that we are going to help also with the preventive. Yeah.
George, he has raised something very important. We have seen people, especially in the urban centers, who do not have a wider scope of land. They do kitchen farming, even this aerial farming as well, given that they do not have space. Do those plants offer the same nutritional value as the one that come from the soil?
Yeah, of course, they offer the same nutritional value. That's why I think it will need nutritionists or people who've done agriculture, and even as an association, to be able to educate the public on the right way to do it. Because again, there's a right way of having a kitchen garden and those kind of stuff. So still some training needs to be done. But kitchen garden is the best way to do it, especially in the urban centers, where there's a lot of food insecurity. It also exists. So that's a good way. But again, it still needs the population to be more educated and be trained on the right way to do it. Yeah.
And given, Stephen, you're the treasurer, for example, you're a student association, where do you get your funding? Do you get it from donors? Are you supported by the government or the Ministry of Health or other organizations within the country?
Okay. KENSA is a non-profit organization, and we're not supported by the government. Most of our allocations comes from the membership subscription. We have, this is a national association where we have more than 2,000 students doing nutrition who are registered under KENSA. They pay a membership fee of 500 shillings annually. However, during when we have, for example, conferences like the one we had recently in March, we reach out to donors, and that's where we get our money.
And do you get support from those donors?
Yeah, we do. Yeah.
And George, coming to you, what other outstanding challenges that is so immediate that needs to be addressed right now so that it can help your association as well as Kenyans at the end of the day get value, not just for money, but for the foodstuffs that they eat on their table at the end of the day?
Yeah. I think one of the most important help that we need is, recognition of the youth leadership in the country, especially in the nutrition space. Currently, we have the youth leadership in that nutrition space is not well, recognized. And that's why we are coming in as an association, so that we want the players in that field. And we are talking about, the policy makers or even the industry experts to come and recognize that we can create an impact. And they can work with us, actually, to make that positive change. In fact, now we even want parliamentarians to work with us, because we talked about policy gaps. Arnold has raised a very important, we talk about the Health Act 2017. The Health Act 2017 lacks, it does not value the role of a nutritionist. But even that, you look at the National Strategic Plan for NCDs 2021-2025, again, does not recognize the role of nutritionists in managing NCDs again. And that's a big problem. And see, if nationally that lacks, if nationally the impact of nutritionists is not recognized, then of course even the county level, even drop down, it will not be recognized. So we want the industry players, we want the government, the policymakers, all these people to recognize the leadership initiatives. Like now the association, they can work with us. And since we are in school, we are leading people in school who are, they are very bright. They have come up with better policies or better ways to do these things. They can work with us and then see how we can work together to make sure that we can raise the gaps in all those, like we talk about the Act 2017, Nutrition Strategic Plan of NCDs. We can identify the gaps and then see how we can work together to bring a positive change in the health sector as far as nutrition is concerned. Yeah.
And Arnold, you do know that we're in the planting season. The rains are here with us. Farmers are getting fertilizers. What recommendations, as even if you're an association for students, what advice have you given farmers around you?
Well, when you're talking of farming, food security is a really essential tool in nutrition. And covering we're looking at crops that are able to yield a good amount of produce at the end of the season. So we're trying to encourage farmers to plant seasonal crops, especially maximize on the current weather. So maize is actually the best option for now because that is our staple food as a country. Yeah, so advising Kenyans to put more effort on agriculture is a really essential tool in terms of food security, which really translates back to nutrition and dietetics. Yeah.
And George, given that necessity at the end of the day is the mother of invention, are we seeing nutritionists, given that you know more about the plants that are being planted in the country, the nutritional values it gives, are we seeing students even venturing? Because agriculture, young people in this country have been accused of not venturing into agricultural sector. So are we seeing students even venturing into that particular sector despite awaiting to be employed in this particular nutrition sector?
Yeah, actually there's a shift towards that because, like I said, because of the undervalue of the nutritionists or under-representation or even under-recognition has made students now to think out of the box. And we have majority now who are diverting to that direction of, engaging to smart farming. And it's helping as they wait for opportunities to come. May come, may not come, but it has, changed or shifted into other ways of doing things. So we have a lot of students who are engaging in smart farming, even into agricultural production and all these things. Yeah. So in a way, it's a good thing in a way, but see that it's only a few who shifted, but majority have not yet shifted. Majority still does not have land to cultivate and to practice all this that they're learning in school. So our interest is to serve the majority, not actually the minority. So if you have few who have shifted their ways into smart farming, maybe because they have an access to land or or capital to do the same, but over majority who haven't or cannot afford to get all those things. So we are speaking for that majority. And the only way to do it is want nutritionists to be recognized in the policies, in the healthcare system, because once they're recognized and the policies are changed, the majority will be absorbed and then the population will gain. Yeah.
Let me give you each a turn to make your final remarks. Let me start with you, Arnold, your final remarks, and to the Kenyans who are watching you right now, and to the people who are seeking to become nutritionists in this particular sector. Are there options?
Okay, yeah, there are options. Anyone, especially those who are done with high school, nutrition and dietetics is a really important course to do, since it's a really strong backbone in terms of the healthcare system of Kenya. And healthcare, nutrition has a really important role in the government. So, yeah.
George, your final remarks?
Yeah, my final remark, what I will say is that we have countries within East Africa who have done well when they integrated nutritionists in their community health programs. We have Rwanda, it's a classical case we can give, and we can also do the same. And our numbers are actually very bad. We talked about 18% of children under 5 suffering stunting. 25% of the adult population are suffering from hypertension. Those are very huge numbers, and this is because nutritionists have not been recognized. If we could recognize nutritionists, then our numbers will go real down. And I've given an example of Rwanda in the year 2015 to 2020. Their rates of stunting reduced from 44 to 33%. And what they did was just simple, to integrate nutrition in the community health program. And we can do that. We have enough nutritionists in the country. Every year students are graduating who are nutritionists, so we have good numbers to integrate into that system. So we just want the policymakers, the industry experts, and those who are manning even the institutions of higher learning to integrate us and to recognize our role. Okay. And I believe the population will be well.
Okay, thank you so much. That is George Omolo, the founder and president of the Kenya Nutrition and Dietetics Students Association, also the treasurer, Stephen Arnold. Thank you for making time for us on the show. And there you have it. Nutritionists are here in the country in various forms, whether in schools, at the end of the day, in the health facilities, they are there. So you can reach out to them and, of course, ask them the right questions. You do hear even the equalization when it comes to the World Health Organization, where a single nutritionist is handling thousands of people. That concludes our topic for the second hour. My name is Abdiaziz Hashim, the sign language interpreter at the bottom end of your screen. That is Lensa Odingo. And of course, up next is Kurunzi Mashinani. Don't go too far.